Hi, we're back. This segment is going to be tough for me because, as you all know, I cry very easily. In the United States, diseases are classified as rare when they affect fewer than 200,000 people. However, since there are around 7,000 rare disorders, that means more than 30 million Americans are suffering, and many of them are children. Now remember, I deliver babies for a living. Because of the rarity of these diseases, patients and their families often struggle to find information, and many of them have started their own advocacy groups to raise awareness and connect with other families who also need help. Now, yesterday was International Rare Disease Awareness Day, and joining me now is Dr. Michael Whyte of Shriners Hospital for Children in St. Louis, and Deborah Sittig, an advocate and a mother of a child with a rare disease. Now, they're both here to help me bring awareness and hopefully provide some help that you all can help with all of these diseases and children that are affected annually with this problem. Welcome you both.
Thank you.
Tell me about Rare Disease Day.
Well, it's coordinated to be an international recognition of these rare disorders that number, as you said, about 7,000 in the United States, and cumulatively in the USA affect 6 to 8% of the American population. But these are primarily genetically based disorders and therefore affect children and adults worldwide. So over the years, patient advocacy groups have grown up around each of the individual conditions, and there's been this coordinated effort to promote awareness.
Right. And for those of you watching, you know, because listen, you all, everybody knows how much fun I have sometimes in life. However, medicine is not House, the television episode. It's not Fringe, the television episode. You know, the NIH, for instance, I think it's the NIH, has a whole branch where they have people coming every day with very strange diseases that doctors don't know what they are. And that's really what we're talking about here. And it happens a lot. And it happened to you, Deborah.
It sure did.
Now, would you care to disclose our I haven't seen Deborah in, what, 5 years?
Yeah, 5 years. And actually, you delivered my son, Cannon, at the time. And, you know, was a little of an abnormal pregnancy in that my ultrasounds were a little bit behind, but nothing that was a red flag that made us really think that there's something really wrong here.
Right.
And, you know, he was born 8 pounds, but as time progressed, after we stopped seeing you, we started to notice that there were some things that weren't quite right. His wrists looked a little wide. He was diagnosed as having hypotonia, started physical therapy as young as 4 months. And
hypotonia, for folks out there, is basically, you know, this being strong. In other words, the muscles are not that strong.
Yep. And he was a little floppy, as they like to say, you know, a little bit weak.
Right. Mm-hmm.
Wasn't sitting real strong, was missing milestones. But I think the real clincher for me was when he was 1 year old and lost a tooth. And there was no trauma or anything that I remember happening. And it was exactly like you just said, that the doctors looked at him. They didn't quite know what to make of it, aside from putting him in physical therapy. And we had to go to a large institution with a multidisciplinary team to really get a diagnosis of a rare disease called hypophosphatasia.
Did it run in your family?
Interestingly, we are told that we are most likely carriers, but one of the classic symptoms is short stature. My husband's 6'4", I'm 5'7". Early tooth loss is another symptom. Never had early tooth loss as far as my parents or I can remember. So it's one of those things where it could have just been. I say my husband and I won the genetic lottery. You know, we both of us were carriers.
So, Doc, looking at her case, because you know this is something that I you know, as an obstetrician, I talk about all the time. You know, which is a question that, and I don't mean this in a bad way, but I hate that question. Is my baby going to be perfect? all moms, listen, I'm a father. You all know that I have an autistic child, right? Because I speak about it openly. So the question is my child going to be perfect? Is a little bit of a loaded question, because looking at Deborah and her history, how rare is that, what she had?
Well, it's her son, Kenan, who is affected, and there are no precise prevalence figures. This is a disease that spans extremely rare skeletal manifestations at birth, proving lethal without treatment within hours or days, out to folks walking around in middle age who might first be cracking a foot bone.
So you could be 30 years old,
Yes.
walking on Fifth Avenue,
Yes.
jogging on Central Park,
Yes.
misstep, crack bone in your foot, and you could have this genetic disease.
True.
Or misdiagnosis having osteoporosis. So it's very interesting, and I mean, some surveys show as 70% of doctors aren't aware of this disease. So there could be a lot more people out there that have it, which is part of the reason I'm here, is to say, if you have that tooth loss, you have that unexplained foot fracture or fracture that pops up, it's a blood panel screening. It's alkaline phosphatase is on a regular blood test.
All right, so somebody looking at this program, they said, well, this is so rare, even though we did the math for you at the beginning of the segment. But so why is it important to bring awareness?
Oh, it often goes unrecognized for years. The manifestations of weakness or a fracture or a tooth loss during early childhood without precise recognition of when that has occurred prematurely leaves this diagnosis unfamiliar to many, many physicians. And it's only when the pediatric dentist realizes that no child should lose a tooth before 5 years of age do you start to get clues.
Right. So if you again, and look, if somebody asked me, oh, my child is 1 year old, he's lost a tooth, I said, maybe it was a malformed tooth to begin with.
Or trauma.
Or trauma, right? He probably fell and it was loose and you didn't realize it.
All the time.
That's right.
So, but again, getting to the point of what the question that I asked, what do we need to bring awareness? One of the things that you said, Doc, is without the proper treatment, especially the pediatric form of this disease, could be deadly.
Yes. If not diagnosed correctly, treatments available for other bone diseases might be applied inappropriately.
Right. So what happened to your son?
So once he was diagnosed, we immediately went to Shriners Hospital in St. Louis, where Dr. Whyte is, where they have a special metabolic bone research center. And there is no FDA-approved treatment at this time. So we participated in research, blood work, x-rays. We go down to the hospital and we're admitted in there for a week every year. And we were just hoping that with Dr. Whyte's expertise and experience that a treatment would become available. And now I enrolled in a clinical trial last week, and he gets his actual fourth injection of this new enzyme replacement therapy tonight.
And the hope is that with this enzyme replacement therapy, he's going to be able to metabolize his phosphorus.
Inorganic pyrophosphate, that's the culprit molecule here.
Right.
Yes. Hypophosphatasia is the so-called inborn error of metabolism, genetically based and is due to deficiency of an enzyme. An enzyme's a protein that should be breaking down other chemicals. There's a deficiency of alkaline phosphatase. And what is now undergoing clinical trials is a bone-targeted form of alkaline phosphatase made by Inobia Pharma in Montreal, Canada. I consult for them. I have research grant support from them. But here, the human bone alkaline phosphatase has been combined with 10 amino acid sequence that puts it right into the skeleton, where then it breaks down this culprit molecule, inorganic pyrophosphate, which blocks calcium and phosphate from going into the skeleton. And the clinical trials are now really approaching 2 years for the very first patients to receive this treatment. Started with compassionate use in infants and severely affected children, where my experience over the last 35 years suggested that when very severe, this is going to be often a lethal disease, and these babies have done extremely well. Rickets is healed, their strength is increased, and now the trials are moving on to children like Mrs. Sittig's son, and even adults with hypophosphatasia.
And just to make a sidebar comment here, you listening to the doc here, you understand that why men and women in science that spend so much time looking at one disease, because there will be not a single doctor, okay, and I know a lot of doctors that would probably understand the metabolic processes that these great researchers do and therapists. So that's why awareness is needed, because research needs to be done. And I know, Deborah, you started an advocacy group, right?
Yep.
Tell me about it.
Basically, hypophosphatasia was a mouthful, so we decided to call it soft bones, because that's basically what we're talking about here. So, we knew that there was research going on, and there really wasn't a patient community anywhere for patients to connect. We had to educate physicians, have to educate teachers of these children and caregivers and their families about what they're dealing with, and provide them with a credible source of information and science-driven information to help them make decisions about managing this disease and making decisions about their life.
Yeah. Do you? And I'm gonna ask you this as a father of a child with autism. At the beginning, when my child had autism, I became very, afraid. But I'm beginning now to not be afraid anymore. Where are you in your cycle?
I was terrified. And that, again, is part of the reason why I started the foundation, is because when he was diagnosed, the first piece of information that I read said that children diagnosed at that age have a 50% chance of survival. So reading that with an 18-month-old son, you can imagine how I felt.
Right.
I was even afraid to touch the baby at the time. I mean, I didn't want to touch him. I was scared I was going to hurt him. So I have evolved to that point now where I feel like knowledge is really so empowering, and I can really help other parents understand, you don't have to be afraid. There's a way that you can manage this disease and find the appropriate treatment.
All right. I'll give you, either one of you, the final word as far as what do we need to tell the public and where can they get more information?
Well, there's a national organization of rare diseases. They would have a website there, a very good source of information. There's an Office of Rare Disease Research at the National Institutes of Health, similarly with websites. These are the places to go to find resources and medical details.
Okay, and you have a website too?
And, yeah, the website for our foundation is softbones.org.
All right, so go and check out those places, especially if you know somebody or you have a child or a family member afflicted with a rare disease. Thank you both for coming.
Thank you for having us.
I'll be right back with some sleep tips, but you don't want to miss this. But first,